What's up guys? If you have Achilles tendinopathy, you have to be doing these exercises that we're about to show you. So Achilles tendinopathy is pain in that Achilles tendon, and we're gonna go over several different isometric exercises for it. My name is Dr. Marco Lopez, Doctor of Physical Therapy and co-founder of the Basketball Doctors. So when we talk about Achilles tendinopathy, we're talking about pain in your Achilles tendon when you're running, jumping, or playing basketball. And it's usually due to failed healing of the Achilles tendon, meaning the tendon's capacity isn't ready to withstand all the events that you're trying to do. So it's pretty much like a glass of water. If you pour too much water on it, it overflows. That's what leads to that Achilles tendinopathy over time. So when you have Achilles tendinopathy, it's gonna hurt in your Achilles tendon. And what we have to do initially is decrease your pain in order for us to do different exercises to make sure you're healing properly. So one of the most important things you have to be doing early on are isometric exercises. So isometric exercises, the good thing about them is they provide pain relief. They have an analgesic effect based on all the research and based on our clinical experience as well, if you properly load them. So why that happens, we still don't 100% know. The research right now shows that there's different representations in the motor cortex that helps decrease that pain. But what we've seen in research and in our clinical practice is that isometrics do help if you truly have Achilles tendinopathy. So today we're gonna go different angles, different positions of isometrics. So we're not only gonna train it vertically, we're gonna train it horizontally, and we're gonna train two different muscles. So the two different muscles are the gastroc and the soleus. They both attach to the Achilles tendon, so we have to position our knee, and we'll talk about it in our exercises, different ways. So when you bend your knee, you're loading more of that soleus muscle. When you have your knee straight, you're loading more of that gastroc muscle. So we have to play those two in a factor when we're doing our isometrics. So check them out.
The first exercise is a single leg heel raise isometric at your end range. So what you're going to do is you're going to keep your weight over your first and second toe. Lift your heel up as high as you can using some upper extremity support to not make this a balance exercise. And you're going to really be active with your contraction as you hold that position. Next up is the single leg soleus heel raise isometric. Use some upper extremity support for some stability. Drive through that first and second toe to lift up that heel. And we're going to bias the soleus by keeping our knee bent and really being active with our contraction here as we hold it. Now we're going to perform isometrics in a different position. So we're going to be in more in an anterior or elongated position here, similar to what position you'll be in when you run or jump. And the same concepts apply. Weight between the first and second toe, drive that heel up, be active with your contraction. No big surprise here. Now we're going to do the same exact position but focusing more on the soleus by keeping the knee bent. Make sure to be really active with your contraction, weight over that first and second toe, drive that heel up. Now we're going to perform the isometrics in the lateral plane of movement. As we know, basketball and all sports happen in various planes of movement, so we really want to make sure our Achilles and foot are strong in the lateral plane of movement when we cut, defensive slide, and other lateral movements. Same concepts apply here. Bend the knee to bias the soleus, drive through the first and second toe to get the heel up, and really make sure you're being really active with your contraction, don't be lazy. Give those isometrics a try when you get the chance. Again, this is all for educational purposes, not medical advice. We are the Basketball Doctors. Let's ball for life.